This is a very exciting study. It's the CLL11 study of the German CLL study group, and it's the basis on which GA101 or obinutuzumab was recently approved by the FDA in the United States. So GA101 is a novel type 2 anti-CD20 antibody, really a third generation CD20 antibody. And so it has a somewhat different mechanism from rituximab or ofatumumab in that it confers increased direct cell death, which is independent of the patient's immune system and probably works by a lysosomal mechanism. It also confers increased ADCC, but less CDC. And this drug has now been studied in a randomized phase 3 study in which older patients with comorbidities were randomized to either chlorambucil alone, to obinutuzumab chlorambucil, or to rituximab chlorambucil. And at ASCO last spring, the initial data comparing each antibody chlorambucil arm to chlorambucil alone were presented, and that was the basis for the FDA approval. But there are two very exciting updates that will be presented at this meeting. First, the GA101 chlorambucil compared to chlorambucil alone arm now has a statistically significant improvement in overall survival, which has never been seen before in this elderly patient population. And then second, the direct comparison of the GA101 chlorambucil to rituximab chlorambucil arm is quite significant for a difference in progression-free survival, where the GA101 chlorambucil arm has a 27-month progression-free survival compared to 16 months for rituximab chlorambucil. And so those data will be presented in the plenary session. In addition, the GA101 chlorambucil arm has a higher complete remission rate and MRD negativity rate, which are signs of a highly active drug.